In the world of pediatric medicine, there is a massive difference between being ready for an emergency and being a level 1 trauma center. So this week, Manning Family Children's Hospital officially became the first and only hospital in Louisiana and in the Gulf South to achieve level 1 pediatric trauma center verification. So Dr. David Yu, Trauma Program Medical Director and Chief Medical Officer for Manning Family Children's Hospital, joining us now to talk about what this means, what it was before, what it is now. Thank you for being here.
Good morning. Thank you so much for having us.
Absolutely. So tell us a little bit about what that means for the safety of the patient coming in and what types of trauma now have better care.
Yeah, so level 1 verification is the highest standard. American College of Surgeons certifies trauma programs all over the country, and they certify either level 1 or level 2. Level 1 means you can take care of any type of traumatic injury in kids 24 hours a day, 7 days a week, 365 days a year, no gaps in coverage, every type of injury, every acuity.
So does that mean that the current doctors had to be tested or educated in that, or does it mean that you had to bring people in from the outside?
Well, I mean, we have people who are qualified, and it means that they all have to have their board certifications and be up to modern care standards.
Right.
And for us, it has meant adding some personnel, but we've had a pretty robust group of physicians there for a while.
Wonderful. Talk about what you see mostly in the patient base that show up at Children's.
Yeah, it's every variety of injury from a trauma center, from a child that falls and sprains their ankle or breaks their leg, to kids involved in severe car accidents, also the occasional stabbing or gunshot injury.
Well, talk about the importance of having the certification when it comes to keeping the hospital up to date with the best care possible for the community. Obviously, if your child gets hurt, you want to have the confidence to go to a place that he or she's going to receive the best care.
Yeah, and a level 1 standard is everything from the minute of the acute injury and taking care of them and making sure they're stabilized and healed. And it's more. It's about having child life, physical therapy, occupational therapy, everything directed for pediatric patients. It's about having rehab capabilities. It's about treating their psychological and emotional needs. It's about getting them from the time of injury to when they are back at school, back doing activities, back being normal kids.
Does it also open up more funding for the hospital to be able to treat more people or to have better technology because you are now level 1?
Yeah, I mean, basically the verification means you have every piece of equipment, every personnel, every staffing to take care of all of these injuries.
To think that New Orleans didn't have this before, just give us your thoughts on that.
Yeah, and it's great for New Orleans, and it's more than that. There is not a level 1 verified pediatric trauma center for literally hundreds of thousands of square miles surrounding New Orleans. So this is for New Orleans and our local community, it's for our state, and it's for the whole Gulf South region.
All right, Dr. Yu, thank you so much for your time. We really appreciate you coming on and talking about this.
Thank you.
Yeah.